Hello, welcome to this Evexia client resource video, which will cover an overview of the Functional Health Report. Now, the presenter for today's topic, the Director of Clinical Support and Education, Dr. Wayne Sedano.
Hi, this is Dr. Sedano, the Director of Clinical Support and Education at Evexia Diagnostics, and welcome to the presentation that discusses the Functional Health Report. As you may know, all Evexia blood test panels come with an analysis report called the Functional Health Report. These reports will add value to your practice by providing you and your patients with an easy-to-read report that ranks imbalances, provides explanations and possible causes for those imbalances, as well as providing evidence-based nutraceutical recommendations. The reports can also help increase patient compliance by helping patients understand and own their own health improvement. The Evexia Diagnostic Health Report is designed to save you time by automatically analyzing every lab element and then compare it over time to help you optimize the patient's progress. So here's a closer look at the report. Aside from reporting on standard or conventional laboratory ranges, the report includes the optimal ranges as well as critical ranges for your review. And like I just said, the report also includes nutraceutical recommendations and a comparison look at past laboratory results. The core tests that determine the outcome of the functional health report are listed on this slide. There is the CBC with differential, there is the comprehensive metabolic panel, the lipid panel, ferritin, iron, and total iron binding capacity, the hemoglobin A1C, magnesium, and thyroid stimulating hormone. Evexia also offers some fantastic patient-facing marketing materials which highlights the features and benefits of the FHR to help support your practice. As a clinician, I know these types of materials can positively impact the patient since it gives them something tangible to take with them and have a look at and refer to later. Also keep in mind that these can be customized to include your logo and contact details, which is pretty amazing. Now, I want to give you a little brief history of the science behind the FHR. Now, several years ago, Dr. Harry Eidner and researchers, they began looking for particular patterns of blood test chemistries that would enhance the clinician's ability to interpret laboratory tests. What they observed were these particular patterns of blood test values associated with many clinical conditions. They also recognized that optimal biochemical processes of the body required a specific range in order to achieve maximal health benefit. Now, patterns of the observed changes in blood analytes as it relates to a particular condition were extracted from reviewing over 10,000 case studies. This slide lists the parameters that they use. They use electrophoresis, they use atomic absorption spectroscopy, hormonal studies, standard hematological studies. They reviewed the patient history and physical examination. They looked at the urinalysis, stool analysis, and hair analysis. So as you can read, the parameters were quite extensive when developing the optimal ranges for certain analytes. And they also mentioned that there are some caveats with interpreting blood test results. First is that the patterns should not be considered absolute and sometimes can be empirical. Second is that no diagnostic procedure is absolute and no lab test should be used as a sole means of making a diagnosis. So please keep these in mind. So on this slide and the next several slides is a look at some of the interpretations the researchers discovered as it relates to functional health conditions and lab test results patterns of dysfunction. So you can use this slide and the next slide as a guide, and I suggest you download a copy of these and have them at your desk. Now the conditions are listed on the column in the left as you see, and then the substances increased in the center, and the substances or analytes decreased over on the right. And I'm just going to go through a few of these on each slide just to give you a flavor for this. First, you can see in the center there's adrenal hypofunction. And what they discovered was that potassium seems to be increased with adrenal hyperfunction, as well as sodium chloride, aldosterone, and plasma and salivary cortisol, as well as DHEA decreased. So on this slide, you can see that anemia, possible iron deficiency anemia, substances increases total iron binding capacity, and the serum iron, ferritin, the RBC indices, and neutrophils, as a matter of fact, were decreased looking at that. Looking at the case studies. On this slide, asthma. They noticed that eosinophils were going to be up. A substance called alpha-2 globulin is going to be up. The hematocrit, hemoglobin, neutrophils, immunoglobulin E, and lactate dehydrogenase, those are going to be increased. And they noticed that lymphocytes were decreased in asthmatic patients. This slide, COPD, we'll go right to the bottom here. Potassium, the white blood cell count, neutrophils, red blood cell count, and eosinophils were increased. And on the other end of the spectrum, the hematocrit, hemoglobin, CO2 or bicarbonate, the lymphids, and a substance called alpha-1 antitrypsin was decreased. Here we can look at diabetes. Glucose, triglycerides were elevated. Hemoglobin C was elevated, should be no surprise. LDL was decreased and CO2 decreased. This slide is going to list the analytes that they extracted that were increased or decreased for digestive inflammation or gastritis, for emphysema, gout, and hypertension. And here are the analytes they extracted for hypochlorhydria, kidney dysfunction, kidney stones, molybdenum deficiency, and osteoporosis/osteomalacia. And on this slide, the analytes they extracted for pancreatitis, for the possibility of intestinal parasites, for polycystic ovarian syndrome. On this slide, the analytes that they extracted that were high or low for the condition of BPH, thiamine deficiency, and zinc. So I think you got an overall idea of the work that they put behind looking at these analytes, and you have a better understanding of the functional health report based on looking at the conditions and the research that they provided. So let's take a look at the functional health report. At its essence, the report inputs certain laboratory results into the computer program that interprets the lab results from a functional medicine perspective. In other words, it looks for those patterns of dysfunction that I just showed you. So here's a segment of the report that reports on the blood test results reporting. And as you can read right under those words, the blood test result report lists the results of the patient's chemistry screen and CBC and shows you whether or not the individual elements is outside of the optimal range or inside the clinical range. Now the elements are going to appear in order in which they appear on the lab test form. So the computer program is going to put them into categories of optimal range, above or below, standard range, above and below, or in the alarm range. And if you notice on the black bar, you'll see the element, you'll see the current report, the previous lab report, whether there was an improvement or not, thumbs up, thumb down. There's the optimal range, standard range, and of course the units of measure. And on this slide, you can see more of the analytes and get a little better feel for really what the report looks like and how it's going to be helpful to you. If we look at, say, calcium, for instance, there is the standard range, the optimal range. There was improvement from the past report and the units of measure, just to point that out. And as we look further down the reports or at more analytes, we'll take the one on the top, ALT, which is a liver enzyme, which you probably know. You can see that it is decreased or below the, right here, the optimal range, which is between 10 and 26. Now, we know as integrative clinicians that when ALT is low, it could be a sign of a B6 deficiency. And this slide shows more of the elements that are analyzed by the functional medicine report computer program. And we'll take a look at homocysteine. Now, homocysteine is listed as above, or previously listed as above the optimal range, which could be a sign of B6, B12, or folic acid deficiency. This part of the report is known as the Health Improvement Plan. Now, the FHR not only lists the discovered potential conditions, it also provides the rationale for the method on determining the conditions that it was discovered on. So, in a way, it is an educational tool. And on this slide, you see that hypoglycemia and the possibility of endothelial dysfunction were disclosed. So it talks about, say, right under hypoglycemia, the results of this blood test indicated tendencies toward hypoglycemia or low blood sugar and the need for blood sugar support. Now, the rationale was that lactic dehydrogenase was low. On the endothelial dysfunction, as it reads, the results of this blood test indicate a higher than optimal risk of this patient developing cardiovascular disease and the need for cardiovascular support. And that was based on the high sensitivity C-reactive protein being increased as well as homocysteine being increased. The report also comes with an easy-to-read functional index, which scores and ranks the conditions into the most likely dysfunction to the least likely dysfunction. Next is the nutrient index report, which reports on 6 areas of nutrient status and provides information and attention that needs to be given to a specific area. The program also ranks the areas of suspected dysfunction, which gives you the areas of dysfunction that need the most attention. And as I mentioned earlier, the report comes with nutraceutical recommendations based on the discovered conditions. So here you see suspected hypoglycemia, which I talked about on the previous slide, and the rationale was a decrease in lactic dehydrogenase, which is associated with reactive hypoglycemia. And here you see the nutraceutical recommendation. This one in particular is called Metabolic Essentials, with the dosage, the directions, and the details.
Thank you for that valuable insight, Dr. Sedano. You can reach us during our extended business hours between 8 a.m. and 8 p.m. Eastern Time, Monday through Friday, by calling 888-852-2723, or contact us anytime via email at info@evexiadiagnostics.com. We are always happy to assist you with any needs or questions that you may have. Thank you again for joining us for this presentation. Until next time, from everyone at Evexia Diagnostics, stay healthy, stay safe, and we wish you all the best on your pathway to wellness.